Okay, on this section we're going to look at the spine, and going off your lab list, know that there are 24 vertebrae. So we have 7 cervical, 12 thoracic, 5 lumbar. On a prior posted lecture I went over how to name them, so make sure that you know how to find the region, the level, the numbers, and if you have to go back and listen to that skeleton review that I posted. Okay, Atlas or C1 is this one right here. So that is Atlas. So let's isolate it. And you're seeing the anterior tubercle. Okay, there's the anterior tubercle. It's a small bump. And then there's the posterior tubercle right there. Okay, now these guys would articulate with the occiput. So the superior articulating facet of Atlas would articulate with the occipital condyles, and that's what allows you to have that yes motion. Okay, C2 or axis. I do want you to know the AKA, so know both. This one's unique because of the dens, also known as the odontoid process. So that's the dens right there, or odontoid process. Okay, be able to identify what bone is from what region. So a cervical bone will have the transverse foramen, and that's where the vertebral artery goes through, and the transverse foramen are found C6 through C1, and vertebral artery passes through there. Let's go back to another cervical bone. Okay, again you'll see a bifid spinous, very unique to the cervical spine. Also a hole in the transverse process. Remember, hole in bone is called foramen, so that's the transverse foramen that you're seeing there. So this would be a cervical. Okay, let's do a thoracic. Thoracic bones classically have this inferior facing long slender spinous. Okay, they also have these costal facets. Okay, there's the superior costal facet and inferior costal facet that receives the rib, the head of the rib. Okay, and there's your transverse costal facet that also receives part of the rib. Okay, so thoracic will have costal facets or rib facets and that long slender spinous. Okay, classic to a thoracic bone. Now let me show you how the lower thoracics start to behave like a lumbar. Okay, so T12, let's isolate it. It doesn't really follow that long slender spinous presentation. This kind of looks like a lumbar. Well, how do you know it's a thoracic? Answer: the costal facet. Okay, so 12 pair of ribs, 12 thoracic bones. Your thoracic bones will have costal facets, so look for that. And then lumbar, typically big bone. Let's isolate it. Okay, lumbar, big bone, and as I put these out for you to identify, I'm not going to try to trick you. It'll be identifiable: a small cervical bone, a medium thoracic bone, and a big lumbar bone. And you'll clearly see transverse foramen, you'll clearly see costal facets, and then the lumbar, you'll just clearly see a big lumbar bone. The short, stubby spinous process that they have. Okay, the transverse process, now this is true for all the bones. Transverse process is this guy here. They are out in the transverse plane. So you have one on either side, transverse process there and there. Now this is a superior view, so this is also the transverse process, and that is also the transverse process. Okay, the vertebral or spinal foramen is the hole that the spinal cord goes through. All the spinal bones have these, so stacked up, all 24 of them stacked up, creates your vertebral canal. Okay, each made by each individual vertebral foramen. All right, the lamina. The lamina is this part here. So this is the lamina on that side, and then there's the lamina on that side. The pedicle is here. Okay, the pedicle goes from the body lamina, pedicle. Alright, let's pick another bone. Let's pick a cervical. Okay. Lamina, pedicle. Alright, the pedicles are at the bodies, and the lamina tapers out into the spinous process. Okay, there is the body. So all the bones, the vertebral bones, have this big distinct body where the disc would sit right there. Now the disc is removed, but that's the body. All of this is the body, also known as the centrum. Okay, the superior and inferior articulating process. Okay, so here you're seeing the lateral view, and this is the anterior side. This is the posterior side. Spinous is pointing down, so that's an inferior. So down here is inferior. So superior part of this bone, inferior part of the bone, anterior, posterior. Okay, orienting yourself is very important because you're going to have to name the superior articulating process and inferior, so that's why you want to orient yourself. Okay, there it is there. The superior articulating process is right there, and the inferior articulating process is right there. Okay, superior articulating process, inferior articulating process.